I think very important for quality of health for Medicare beneficiaries. I yield back.
Thank you very much, Mr. Carter.
Well, thank you, Mr. Chairman. I appreciate the opportunity to testify about this on the Advancing Telehealth Beyond COVID-19 Act. You know, you may have heard me say it before, but there are two Georgias. I mean, Georgia's a very advanced state, but there's Atlanta and everywhere else. And everywhere else includes South Georgia, and South Georgia is very rural. And we have a lot of areas in South Georgia that need telehealth and that have benefited from telehealth. I grew up in a small town, albeit near Savannah, a larger area, but at the same time, that small town has utilized telehealth just as well. And that's why it's so vitally important. And, you know, as you know, I'm a healthcare professional, a pharmacist, and serving in Congress, one of my top priorities since I've been a member of Congress has been to make sure that healthcare is accessible and available. And that's very important. And telehealth has made it available. If you remember, there was an article in the London Times, I believe, that said that telehealth has advanced more in 1 month than it had in the last 10 years. And it has. And it's become an integral part of healthcare. There's no question about that. And the pandemic has really only further convinced me that of the importance and of the benefits of telehealth services for patients and for healthcare providers as well. And it's obviously important for the pandemic, but it's also important because in rural areas, and particularly in South Georgia, we have a lack of healthcare professionals. We have a lack of physicians, a lack of psychiatrists, of specialists. And this helps us. Telehealth helps us address that problem. So it does more than just address the problem during the pandemic. It helps us address a bigger problem as well. You know, just months before the pandemic, in fact, prior to the pandemic, Medicare beneficiaries had roughly 13,000 telehealth appointments per week. That increased just months into the public health emergency. That increased over 3,000%. 3,000%. That's what I said. It's grown more in 1 month than it had in the last 10 years. We've been talking about telehealth in the Energy and Commerce Committee for years, ever since I've been a member of the committee for the last 6 years. And we've been talking about that as the wave of the future, the wave of the future. Well, guess what? The wave of the future came immediately during the pandemic. And it was a great benefit. But it's, you know, the challenging thing that I found here is that this is a missed opportunity because we could have done better with this. This is a good bill, yes, and it's necessary. But it didn't go through the committee process. I would submit to you, and you know, the Energy and Commerce is the most important committee in Congress. I'm a little biased in that. I get that. But at the same time, this is why we have the Health Subcommittee. This is why we have the Energy and Commerce Subcommittee, our committee, to go through bills like this. But this has not gone through the committee process, and that's a shame. I think it was a missed opportunity. I had legislation. I introduced bipartisan legislation along with Congresswoman Lisa Rochester Blunt. And I would submit to you, and I'm sure the chairman would attest, that she and I have worked on more bipartisan legislation than just about anybody. We have worked together on numerous occasions. We introduced legislation that would have addressed this to make sure that seniors didn't lose access to telehealth, because it has become so very important. Now, again, yes, this is good. This bill is extremely important, but it was a missed opportunity in the sense that we could have made it even better if it had gone through the committee process. One of the examples I would give with that is that we have not even had CMS to testify before the committee, before the Energy and Commerce Committee this session. We could have addressed some of the concerns that we have here, such as waste, fraud, and abuse. And look, as good as telehealth is, there is the potential there for fraud, and we all understand that. So I'm here to testify in favor of the bill. You know, we know what happened during the pandemic. The Trump administration waived some of the regulations, and we saw that telehealth became an integral part of healthcare. I'm optimistic about telehealth. I think it's going to give us the ability to improve the health and the wellness of America, making accessibility and affordability even better. But there are things that we need to check in this, and we need to be careful about it. And I would submit to you that while I support the bill, it's a shame. It's just a shame that we didn't take something as important as this, take it through the committee, and make sure that it had the best possible product. And with that, I'll yield back.
Yeah, so let me just say that, I've talked to doctors and patients alike up in Massachusetts about the importance of the flexibilities that were put into place during the pandemic, and they all believe that this should continue. They also, and I represent rural areas, I represent suburban areas, I represent urban areas, even for people who live in the city. If you're a senior citizen, who doesn't have easy access to transportation or who has trouble kind of getting around, getting to a doctor's appointment or getting to a hospital where your doctor might be is a monumental task. And not every appointment has to be, I need to see you in person. I can, sometimes it's just being able to see the person. So I think this should continue. I don't know, Mr. Pallone, would you want to add anything, or?
Well, I would just, obviously, Mr. Carter's supporting the bill, so I might be best to just leave everything alone. But I would say that, just so you understand, the reason that we're just doing it for 2 years is because of the pay for, right? In other words, we were able to come to agreement on a pay for. It costs about $2.5, I don't know what the figure is here. It's like about $2.5 billion to pay for the extra 2 years, and we couldn't come to an agreement on, beyond that. So that's part of it. The other thing, too, is that we really want to spend some time, the way he's discussing, looking at this long term. And there's a report that's coming out, I think, in sometime next year, that's studying the impacts, cost, quality of care, access, program integrity, and all that. And so, I don't disagree with him, but basically what we're doing here is just extending the program the way it is for another 2 years, and trying to do that before the end of the year, because there's not that many legislative days available. And we'll continue to do oversight and try to come up with a funding source, to go beyond. But that's why it's limited to the 2 years.
Well, there's an old saying, you don't have to agree on everything to agree on something. And the something we agree on, we ought to move forward, and it seems like you both agree on there's something, and I hope there's a strong bipartisan vote on the floor when this comes up. Mr. Cole.
Thank you, Mr. Chairman. First, I want to do something I almost never do. I want to completely associate myself with your remarks in an opening statement. That doesn't happen very often. But I agree very much with you in this case. Also want to remind my friend from Georgia, if the Appropriations Committee does not do something, government shuts down. So top that. All these committees are important, but the most important one is the one that keeps the lights on.
And by the way, so are we. I was going to object when you said.
I'm sorry, did I touch the nerve?
Yeah,
I didn't.
okay.
Well, you're driving the chairman and me together here, though, so that's okay. That doesn't happen very often either. I do have one quick question from my friend from Georgia. So I want you to expand a little bit on some of your concerns. I know that many on both sides of the aisle, including both of our witnesses, been working on this issue of expanding telehealth for a long time, even before the pandemic. So in your opinion, do you think the legislation goes far enough?
Well, that's why I say I just feel like it was a missed opportunity, because I think we could have done better if we got, and why have we got committees if we're not going through the committee process? Let's just do away with the committees if we're not going to go through them and not utilize them.
Right.
And we really we could have done so much better, and yes, you're correct, and I am supporting the bill, but at the same time, I just felt like we could have done a lot better. We had a good product in energy and commerce that we had the opportunity to get CMS in to testify before us, to tell us how we could have avoided waste, fraud, and abuse. We could have looked at how we could entice and encourage the private insurance companies to get more involved. All of those things are why you have committees. I'm just frustrated because we didn't go through committee.
Well, it'd be my hope that you will have the time to do that and the time that we give you here today. But I know continuing what we do have, as you both agree, is pretty essential right now. So I appreciate the bipartisan cooperation on that and on the legislation before us, and hopefully soon there'll be additional legislation that ranks in this area. I trust both of you to make sure that happens. And with that, Mr. Chairman, I'll yield back.
Thank you, and I want to ask unanimous consent to insert in the record the statement of administration policy in support of this bill, without objection. Mrs. Torres.
Thank you, Mr. Chairman. I just want to take a moment to thank both of you for bringing this really important bill to our committee. And I would say, no disrespect, but if your committee was more important than ours, why are you here before us? But
I've
putting
been
that,
asking myself ever since I got here.
your committee is very important to the House.
And so is yours.
Thank you. Nothing in this bill, and I regret that it's only 2 years, but I would say, Mr. Carter, nothing in this bill stops you from working together in calling CMS and having some oversight. And I hope that in that oversight, you would also include tracking of savings that we know is happening as people have more options to visit and speak to their doctors. I think that we get ahead of complications and therefore save on hospital stays, calls to 911 and paramedics and all of that. So I hope that you will take that under consideration as you continue to move this legislation forward and call in CMS to have that badly needed oversight. Way back in 2000, when I was first elected to City Council, we had a joint powers agreement between 4 cities for mental health services because no one had enough mental health providers. So telehealth was a big part of that work. It worked for us back then, and I think through COVID, expanding this program, it has been so critically important. For me, it's helped me a great deal. I can't tell you how many times I've had appointments with my doctor right from the payphone booth off the House floor. So thank you for expanding it and giving all of us that opportunity to continue to see our providers and continue to get ahead of our healthcare issues. And with that, I hope we do get bipartisan support, and I yield back.
Thank you. Dr. Burgess.
Thank you, Mr. Chairman. And Chairman Plone, I just have to ask you, was there a reason not to do at least a legislative hearing on this concept of telehealth? I mean, we've all known, not just through this Congress, but even the previous Congress, we've all known that it's functioning under a waiver, enormously popular with patients, providers, and that we were not going back to the status quo of what it was before the pandemic. So what's the holdup on doing a hearing and at least get CMS to come in and testify to us, maybe the CBO to talk to us about what the cost would be? We could have done that. We should have done that. I mean,
Well, we had a hearing on telehealth in general, but we didn't have a hearing just on this bill. The hearing, I think, was in March, was last year we had a hearing, and it was in this session, but it wasn't on this specific bill. I guess, look, I guess I'm repeating myself, but, we did this extension essentially till the end of the year in March. This is the same language. By the end of the year, there are many things where we just go to the floor and attach them to other bills. We call them extenders. In my view, this is very important. I mean, we don't come back again until, I don't know, like the middle of September. There's not that many legislative days left. So, I think the feeling was we had a bipartisan consensus with the pay for the $2.5 billion. And it just made sense to try to move this as quickly as possible so we could get the Senate to do it. And we're waiting for this report that comes out early next year that will go into a lot of the things, that Mr. Carter mentioned. So it just seemed like, let's get this going. We have the pay for, and we'll continue to monitor it for the future. We'll still look at a permanent bill the way Mr. Carter is suggesting.
well, I think Mr. Carter is exactly right. I hope we do spend the required time on that. It's uncomfortable to me for us to say, here is a provision that turned out to be extremely popular with patients and physicians. We're concerned about the cost, so we're not going to go forward with a permanent solution, which I think kind of slows things down. But on the other hand, I mean, this is what patients need, and they've told us, and physicians have told us. So since we've never had the true type of hearing to ask the question of the agency, what does this truly cost? What are potential savings? What avenues have you explored? But just to tell people that they can't have it because the proper way to deliver your care may cost a little bit more and we don't want to do it properly, that's a terrible message for us to be sending to patients and doctors. Mr. Carter, let me just ask you, I see in the amendments that have been filed, there's one by Michelle Steele of California, Mr. Schneider of Illinois, that extends for 2 years the first dollar coverage of telehealth services for those with a high deductible health plan in combination with a health savings account. This has been standard under the waiver, but it expires on December 31st. So that does seem like a good idea to continue that type of exception for high deductible health plans and people who have high deductible health plans and health savings accounts. Would you agree that amendment?
I would agree, and thank you for making that point because it is important. It is very important. And I want to thank you and Representative Torres as well for making a point about this is not just about money. This is better health care. This delivers better health care in our country. It delivers better health care in the sense of accessibility and availability. And that's so vitally important. And it's going to be even more important in the very near future and right now. As we come out of this, as we have been cooped up for the last couple of years, the mental health issues that are prevalent in our society have got to be addressed. And this will give us the opportunity to do that.
Well, and not only that, when this goes away, or if it were to go away, there would be a significant increase cost to patients, and that's got to be reflected somewhere. It's one of those things you pick up on right away. Patients are never shy about telling you that, hey, wait, this is great. You mean I can get this solved over the telephone or with a computer visit, and I don't have to hire a babysitter, I don't have to miss work, I don't have to pay your exorbitant parking in your parking garage. I mean, there is a lot of potential savings downstream of us fixing this problem permanently. So I agree with you, Mr. Carter. This is something we could have worked on in a more collaborative way, and perhaps we could have come up with a permanent solution. The good news is in Washington, there's never any permanent victory nor any permanent defeat, so we'll live to fight another day. I do want to, I brought this point up last week when we were having one of these bills that they brought to the Rules Committee first rather than going to our committee, which I agree with you, is at least one of the premier committees in Congress. There are several. I'm fortunate enough to be on 2 of them. But since we're talking about big cats later on today, the Rules Committee is kind of like the apex predator of legislation. I mean, you don't come to us first, you come to us last. And really, our committee work in Energy and Commerce is extremely important. We don't have open rules on the floor of the House anymore, but every member on the committee has an opportunity to be heard. The chairman can either say yes or no, I'm not going to continue to work with you on what seems to be a good idea, and that to miss out on that is to really miss out on a big part of the legislative process. So thank you, Mr. Chairman, for allowing me to get that off my chest, and I'll yield back.
Mr. Perlmutter, let's see, Mr. Raskin.
Thanks, Mr. Chairman. Chairman Pallone, thank you for your bringing this forward. Mr. Carter, I just want to concur with you about the problem of the paucity of mental health care in rural areas. I represent a lot of rural areas in Frederick County and Carroll County, Maryland, and it's a very serious problem. I mean, there's a general shortage of mental health practitioners across the country, and it's especially dramatic in rural counties, and it's a real problem. And so I hope that in addition to this, which will be, ameliorative and help in some ways, we need to look in much more sweeping ways at dealing with that problem, getting more people going into the profession, incentivizing people to go into it, and coordinating much better between mental health practitioners and primary healthcare providers. So it's not just like contracted out to some provider who basically runs defense against getting people the care that they need. So I've talked to a lot of people about that, and I hope your committee can take a serious look at it. And I don't know whether you have any legislative proposals in the works on that or ideas that you've been focused on. Or Mr. Chairman, if you have any comments on that. Yeah.
Ago now that we did a bill that was bipartisan that passed the House, and we're trying to get the Senate to move on that and so many other things, which really does a lot along the lines of what you suggested.
Yeah. All right, I yield back. Thank you, Mr. Chairman.
Thank you. Mr. Reschenthaler.
Thank you, Mr. Chairman, and thanks to both witnesses for coming in today. Always nice to hear from both of you. Mr. Carter, do you want to talk about some of the missed opportunities to work to prevent waste, fraud, and abuse with this, or I guess I should just say fraud and abuse with this?
Well, yes, and I'd just say, again, that's why the committee process is so important. So we could have had CMS testify before us so that we could prevent some of this. That's going to happen. None of us are naive enough to believe that waste, fraud, and abuse doesn't happen, even in the best programs, and I would submit this is one of the better programs. But it is going to happen, and that would have given us the opportunity to look at it and to figure out how we could have avoided some of that. I get it. I understand that 2 years is better than nothing, and the way that this works, of course, when you have a public health emergency, as all of you know, it's up to the Secretary of HHS. He said that he'd give us 60 days notice, and that's great. But we need, people need more than just a 60-day notice and that it's going to be ending. We need to be able to prepare for these type of things. So I just felt like, if we'd gone through the committee process, we had a good bill in Energy and Commerce that, as I alluded to earlier, Representative Rochester Blunt and I have worked on together, but we didn't get to it. Now we're running out of time. It is what it is.
Mr. Chairman, do you have anything you want to add?
No, I mean, again, I don't want to be repetitive, but in March, well, I don't know when exactly it is, but
It was March 2021.
Yeah, well, in the legislation, the extender in March tasked this is an extension of that, right? That tasked the Medicare Payment Advisory Commission, MedPAC, and the HHS Office of the Inspector General to study the impacts on cost, quality of care, access, integrity, which is the abuse that Mr. Carter is mentioning. And they're supposed to report back to us in the spring of next year. So the idea would be that we'll review this and look into the fraud and abuse and some of these other things to see whether we want to make this permanent.
Thanks, Mr. Chairman. I appreciate it. With that, I yield back.
Thank you. Ms. Scanlon.
Thank you, and thank you, Chairman Malone and Pallone, and Ranking Member Carter. Like others have said.
You hear that, Ranking Member Carter? She said Ranking Member Carter. I just want to make sure y'all.
Sorry.
Pardon me?
There we go. As several people have said, my constituents have really benefited from the expanded access to telehealth throughout the pandemic for many of the reasons that Chairman McGovern said. Difficulty with transportation, especially seniors. So we do look forward to being able to extend these services and appreciate your bringing the bill forward. So thank you. I yield back.
Ms. Fishbach.
Thank you, Mr. Chair, and I would like to associate myself with the comments of the other members on the Republican side, but I do want to just kind of share that issue with that Mr. Carter mentioned, and I didn't call you Ranking Member Carter, but Mr. Carter, about the missed opportunity that because many of my constituents have benefited from telehealth, and I think the agreement here is that we all support it and would like to see it being used wisely. And particularly in rural areas, as Mr. Carter had mentioned. And so I appreciate the bill, but I do think that had it gone through committee, we could have really put together a strong bill that would have addressed more issues, and we could have extended it longer than 2 years, because I think that that's an important thing, too, that we make sure that people understand, when they're dealing with their health care, that it's not just a 2-year thing that they may be able to partake in, but this is going to extend into the future. And so I just feel, while I support the bill, I do think we missed an opportunity, and I wish we would have taken the time to send it through committee and really done the work that we should be doing on this huge issue. So, and with that, unless Mr. Carter has anything else he'd like to add, I will yield back.
Fine, thank
Mr. Chairman, I yield back.
Except I did like the sound of that ranking member. I just,
Well, maybe soon we'll use that. Thank you.
Mr. Morelli.
Thank you, Mr. Chairman, and thank you to Chairman Pallone and Representative Carter, in whatever capacity you're here in, for being here. I certainly concur with what my colleague just said about the importance of this. I don't see this as a missed opportunity. I really see this as a starting point. And there is so much more, I think, that we can and we do need to think about, particularly as I often think about this issue over the next, well, I guess I'm about 2/3 of the way through the baby boom generation. And so we have about 7 more years, and all the baby boomers in the United States will be Medicare eligible. And utilization for Medicare or for health insurance once you retire is relatively modest in the 60s, but we know statistically it goes up pretty dramatically when you get into your 80s, mid-80s. So we have probably, if you sort of look at it statistically, about 15 years, and we're going to have a pretty dramatic utilization rate among Medicare recipients. And one of the way, and by the same token, if you look at sort of the demographics of where we are, we're going to have fewer people in the workforce as a ratio of those in Medicare than we've ever had since the inception of the program. So in my mind, it really calls on us to think deeply about what we will transform to if we're going to be able to afford and continue to expand on services for Medicare. And I think technology and innovation offers an enormous opportunity for us. Excuse me. So we have not only the ability to communicate with one another via telehealth measures that we're talking about today, but if you think about the expansion of the ways in which we do diagnostic work and other kinds of medical devices, I even think of when I'm exercising in the morning, I'm checking my heartbeat, I'm looking at a whole host of things. In time, with sensor technology and what we're able to know, I could envision a world where we're literally in real time uploading data at scale that we're going to be able to communicate information to primary care providers and specialists literally instantaneously. And if you think about it, there may come a time where your primary care provider calls you or texts you or emails you and says, I don't like some measurement or some indication, I want you to come in. I mean, think about if we really want to get to real wellness in the world and in the United States and really think about how to get upstream for illnesses, either to lessen the impact of chronic illness or really to get upstream to limit pretty dramatically acute illnesses, innovation and technology offers us the kinds of tools that just weren't available 10, 15, 20 years ago. So I like this but I think it is a starting point. I mean, I think there's so much more that we can do, and by necessity we'll have to do, both in terms of quality of care and in terms of affordability. So I support this. I've worked on a number of projects back home in Rochester, New York, around telehealth, in innovation, in practice transformation. We've done a number of things when I was in the state legislature in New York. So I see this as all good. I do think there's a lot of opportunities here in the future, and I just appreciate both of you being here, appreciate the good work, and I'll support the underlying rule or the rule in the underlying bill, and thank you both for being here. I yield back.
Thank you. Mr. DeSagne.
Thank you, Mr. Chairman. I just want to associate myself with almost all the comments of all of my colleagues, Dr. Burgess and Mr. Chairman. Your overall cost, I'm not a believer in dynamic scoring, but at least we should consider all of these things. And as a reluctant consumer of healthcare products, and as one of 7 million Americans with an immunocompromised system during a pandemic, telehealth is just remarkable. And my providers as Dr. Burgess said, my doctors have all asked me frequently, how do we do more of this? So, Mr. Carter, I've always enjoyed our relationship, the work we've done on cancer prevention and research, and I look forward to, as Mr. Morelli said, this being a sort of starting point in a further discussion I think we can all agree on, and would be quite transformative for Americans. So with that, I yield back.
Thank you very much, Ms. Ross, Mr. Neguse. Does any other member of the committee wish to ask a question? Seeing none, I would like to thank our witnesses for their testimony. Please leave with our stenographer or submit electronically anything you would like inserted in the record. You are now excused.
Thank you, Mr. Chairman.
Thank you very much.
Yeah, good. Saved by the bell.
We will now hear from any amendment witnesses on H.R. 4040 at the end of the we will hear from any amendment witnesses on H.R. 4040 at the end of the hearing portion of today's meeting.